In this short video, we'll cover the top 5 work and health tips for human resource management. The tips we will cover apply whatever the size of your organisation and whatever the sector of your organisation. Think of these 5 tips as the foundations for a healthy and productive workforce that you can build on. Let's get started with tip number 1. Process is paramount. A solid process benefits both the organisation and the individual when issues arise at the work health interface. Processes provide clear parameters for identifying deviations in productivity, attendance, or performance, and these are early indicators that an employee's health might be affecting their work. Processes can include everything from sickness absence monitoring to 360-degree feedback. And these processes serve as checkpoints, helping support early detection of any issues, as well as guidelines. When situations are complex, guidelines provide a crucial starting point. Without them, health issues impacting work can spiral, leaving both the employee and the organisation at risk. So let's move on to tip number 2. Process is not a panacea. While processes are paramount, they also have their limits. Equality legislation is built on the principle that no single approach works for everyone. While processes provide a framework, there are times when they need to be adapted as part of reasonable adjustments when supporting an employee living with long-term ill health and disability. Whether it's deviating from a flexible working policy or pausing sickness absence proceedings, adjustments may be necessary for a process to be effective, reflect a diverse workforce, and ensure the organisation is operating ethically and legally. Here's tip number 3. Communication is key. Health issues affecting work or work that is contributing to ill health must be acknowledged and addressed early. Delays in addressing issues at the work health interface often means things will become more complicated with time and even more difficult for the organisation and the individual to bounce back from. Communications and outcomes from communications, such as when workplace adjustments are made for an employee's health, must be explicit and documented. Communication also links to processes, which often include formal communication checkpoints, such as sickness absence meetings, which help ensure that everyone involved is clear on next steps. Tip number 4 is maintain confidentiality. The challenge with aiming for open communication is that health information is highly sensitive and must be handled with care. Employees' health details should always remain confidential unless they choose otherwise. When communicating about work and health, instead of focusing on the specifics of an employee's condition and asking for confidential health information, the organisation should try to understand how an individual's health impacts their function at work, what they can and cannot do. Let's move on to tip 5. Know when to lean on expertise. The 4 top tips we have covered so far demonstrate how nuanced human resource management around work and health can be. Even with strong processes and clear communications, HR cannot do it all when it comes to work and health. Firstly, most HR professionals don't have clinical training, which can be important in assessing the impact of health conditions on work. Secondly, HR is fundamentally an employer function, and employees may wish to keep private health information separate from their employer. Occupational health solves for these issues by providing clinically expert and neutral confidential support that bridges the gap between an employee's health needs and their workplace requirements. Employers, managers, and HR should leverage what occupational health can offer in supporting employees with work and health issues. Occupational health unlocks clear communication between organisation and individual while maintaining confidentiality by keeping clinical detail separate from employer recommendations. Occupational health can also help develop organisational work and health policies and improve on these through data-driven audit. So, here are the top 5 work and health tips for HR in summary. 1. Process is paramount. 2. Process is not a panacea. 3. Communication is key. 4. Maintain confidentiality. And 5. Know when to lean on expertise. Remember, occupational health can help with each and every one of these on a case-by-case basis as well as on an organisational level. And remember that these tips are relevant to all types of organisation, regardless of size and sector.